Now we're going to have a look at multiple injuries, and with first aid, often when you're doing a standard first aid course, you look at one injury. So you might have a cut to the arm, it might have an amputation if you're doing more advanced courses, or a knife injury. But this is one of our trauma mannequins, and obviously this person's had pretty much a bad day, but you've got lots of different injuries on the one patient. So what you need to do is start to prioritise and deal with what you're dealing with. So, obviously we need to maintain the breathing. So let's just assume in this case that breathing is not an issue. Blood loss is the key one here. So you need to be making some decisions. How are you going to be treating each one of these injuries? Which are severe, which are not, which are causing the most blood loss? So your key area is blood loss to start with. So maybe these amputations are causing a lot of blood loss straight away. This leg's not much better. It's got some very serious injuries on it. So maybe we need to put tourniquets on one or even both of those, get them dressed up, maybe use hemostatic dressings. Maybe the burn up the top here could be a lower priority, albeit it's a very serious case, but is it going to kill them immediately, whereas some of these others may well do. Now you've obviously got loads and loads of other risks here, from infection, from blood loss and that, and dealing with something like this can be extremely frightening when you look at maybe one day I might have to deal with something like this in a bomb blast or a terror incident or something like that. But when you do get this, I promise you, your training will kick in, and what we'll cover on courses, we look at all sorts of different injuries, but what we found when we're talking to people afterwards who do have to deal with this sort of thing is they go into autopilot. The training kicks back into their mind and they get on and deal with it. So something like this, you're going to need to prioritise, which is the key thing. Look at what you're dealing with, try and assess very quickly to make sure which ones are the most life-threatening and deal with them accordingly. If you do need to get a tourniquet on this leg and this leg, get it on as quick as possible so that we can stop that bleed. And then we know, as far as we're concerned, this end is okay. It's got the tourniquet on. Yes, there's a very serious cut here, but is it bleeding badly? Maybe we could just pop a trauma dressing on. One of the big concerns here would be the knife. So we may need to stabilise that. And this patient, it's not someone we could easily move or anything like that. We need to stabilise them where they are and try and make sure that we get the right messages across. Now, in the event of a major blast or a major incident, this might be just one of many patients looking very similar or with lots of other injuries on them. So, that comes down to your individual triage. But if you were dealing with this patient and you're trying to make sure you're treating the best you possibly can, you can still get other bystanders to help other people, because in the event of a major incident, it may well be that it does take time for the emergency services to be able to get to you in that emergency. So the more we look at each one of these individual items, the more confidence you'll have for dealing with it. So on other videos, you'll see how to deal with burns, how to deal with open fractures and knife injuries and amputations and bullet wounds and things like that. So think about those, but when you deal with someone, it may be you've got a casualty with multiple injuries.